Normally, the red blood cells remain suspended uniformly in circulation. This is called suspension stability of red blood cells. If blood is mixed with an anticoagulant and allowed to stand on a vertical tube, the red blood cells settle down due to gravity with a supernatant layer of clear plasma. The rate at which the erythrocytes settle down is called Erythrocyte Sedimentation Rate. We also call it ESR. We can also call it sedimentation rate, SED rate, or Bernanke reaction. It was first demonstrated by Edmond Bernanke in 1897. There are two methods to determine ESR. Number one is by Westergreen's method. Westergreen's tube is 300 mm long and opened on both ends. 1.6 ml of blood is mixed with 0.4 ml of 3.8% sodium citrate. The sodium citrate is usually an anticoagulant and it is loaded in the Westergreen's tube. The tube is fitted to the stand vertically and left undisturbed. The reading is taken at the end of 1 hour. The second method is by Winthrop method. Winthrop tube is a short tube which is about 110 mm long. It is open on only one end. About 1 ml of blood is mixed with the anticoagulant. The anticoagulant is usually EDTA. The blood is loaded in the tube up to 0 mark and the tube is placed on the Winthrop stand. And the reading is usually taken after 1 hour. Winthrop tube is also used for determining packed cell volume. Now let's talk about the normal values of ESR. By Westergreen's method, in males, it is 3 to 7 mm in 1 hour. In females, it is 5 to 9 mm in 1 hour. In infants, it is 0 to 2 mm in 1 hour. Let's look at the variations of ESR. We usually have physiological variation and pathological variation. Now, for physiological variation, the first one is age. ESR is less in children and infants. The second one is sex. It is more in females than in males. The third one is menstruation. The ESR increases during menstruation. The fourth one is pregnancy. From 10 months to parturition, ESR increases up to 35 mm in 1 hour. Now let's go to pathological variation. ESR increases in diseases such as number 1, tuberculosis. Number 2 is all type of anemia except the sickle cell anemia. Number 3, malignant tumors. Number 4, rheumatoid arthritis. Number 5 is rheumatic fever. Number 6 is liver diseases. ESR decreases in the diseases such as allergic conditions, sickle cell anemia, and peptone shock. 4 is polycythemia. Number 5 is extreme leukocytosis. Now let's look at the factors affecting ESR. The first one is specific gravity of red blood cell. When the specific gravity of the red blood cell increases, the cells become heavier and ESR increases. The second one is redox formation. It increases the ESR. Albumin and globulin accelerates redox formation. Number 3 is increase in size of red blood cell. When the size of red blood cell increases, ESR also increases. Number 4 is viscosity of blood. Viscosity offers more resistance for settling of red blood cells. So the ESR decreases when the viscosity of blood increases. The fifth one is RBC count. When RBC count increases, the viscosity increases and ESR decreases. And when the RBC count decreases, ESR increases. Thank you for watching. I hope to see you in our next class.